Good afternoon, ladies and gentlemen. This afternoon, we have had a very important visitor to see His Excellency, Mr. President, Bola Ahmed Tinubu's GCFR in his office to pay a courtesy and have audience with him, discuss some important issues regarding the health and social well-being of Nigerians. As we all know, the President is very committed and has directed that we do all that we can to improve the health and well-being of all Nigerians as part of his renewed hope agenda. Accordingly, in recent few days, he's approved 3 important steps for us to move forward with that, and has asked us to talk less and do more. And in that spirit, he, in fact, has asked us to pursue a very ambitious sector-wide program to improve population health outcomes, using the Basic Healthcare Provision Fund as a basis for reviving our primary healthcare system, working with state governments and community leaders, traditional leaders, to ensure that Nigerians get better quality services to deal with the issues that bother them, whether it's malaria, whether it's immunization, maternal and child health, reproductive health. Those are elements that have direct bearings on the health and well-being of Nigerians, with the state governments and with our development partners. So that sector-wide program is on the way, and our visitor today is committed to work with us in that, to work with country systems, not set up parallel systems. And we're very glad that the Susan Buffett Foundation is willing to partner with the government of Nigeria to advance the health and well-being of all, especially our adolescents, our girls and women. The second item is to unlock the value chain in the healthcare space. The President has also approved an initiative, presidential initiative, to unlock the healthcare value chain. That will help drive the medical industrialization agenda with clear targets. It will require public sector, private sector working hand in hand. Government doing what it needs to do to provide the enabling environment, and the private sector getting its acts together to ensure that we produce the things that are critical for the health and well-being of Nigerians while creating economic value and creating jobs. And thirdly, directed us to design a social action fund, a way of reaching communities so that we trust them, we empower them, we support them to solve the issues that are very simple, that are afflicting many of our people in the grassroots. That is complementing other efforts of government, of course, in terms of alleviating the pain that is in parts of our country, in many parts of our country. And the President very much empathizes with that and is doing all he can to ensure that we begin to bring succor to the people. So that is the direction, and not much more to say other than we'll get to action and we'll deliver on the basis of what Mr. President has directed us to do. And we thank our visitors who joined us in the audience with Mr. President. Professor Sanaid Feseha is here, and I don't know if you would like to say a few words. Yes.
Good afternoon. As the Honorable Minister mentioned, my name is Professor Sanaid Feseha. I'm the Vice President for Global Programs at the Buffett Foundation. We're absolutely excited to partner with the government of Nigeria. The Renewed Hope campaign and commitment is exciting global partners to say, how do we align with the government? Our foundation particularly focuses on women and girls, but also basic primary health care and meeting governments and communities and partners where they are. So we are extremely excited. I don't want to duplicate what has been said. I do like the President's direction on talking less and doing more and getting to action. So our hope is that we will be a committed partner to supporting the federal as well as state governments and communities to deliver health for all. So thank you very much for the opportunity today.